This is the indieJourno.com. I'm Paul Matadine. The Senate healthcare vote has been delayed. So now what? I just spoke to Dr. John Patrick. He's the author of Heath Attitudes, Unraveling and Solving the Complexities of Healthcare. And I asked him, if attitude's the problem, where do we go from here?
Well, it's all about attitude. That's my theory. And it's about the attitude of patients and providers and policymakers. And our policymakers, unfortunately, have added a fourth P, which is politics.
Right.
And that's what's slowing it down. And I don't think at this point anybody knows what the outcome will be. But the major disappointment that I have, and I think we all should have, is that the subject isn't really being addressed properly. It's being addressed politically. The real issue is the cost of delivering healthcare, which is 50 to 100% more per person in America than it is in other countries. That is the problem, and that's really what we should be talking about.
Dr. Patrick told me the core of the healthcare problem in America is that the numbers simply don't work out.
The total cost is excessive, and so when you try to squeeze it, it's the old story of trying to put 10 pounds in a 5-pound bag, almost literally. If you look at the cost of the 20, 30, 40, or 50 million people, whatever number you believe are people that are inadequately covered from a health insurance point of view. If you look at an average cost per person of between $5,000 and $10,000, the total cost to insure people is $150 to $250 billion. Now that's a lot of money, but it's nothing compared to how much we waste. If you look at unnecessary tests and procedures, plus fraud, inefficiency, and other problems in our healthcare system, we waste somewhere around $1 trillion. So we can afford to address the problem if we stand up to the real problem, which is the cost of delivering healthcare.
So the obvious follow-up question here is, what can people like you and me do?
Well, a good place to start is with the pharmaceutical industry. People should be outraged that we get carpet bombed every day with 15 or 16 ads about very expensive, high-profit drugs, many of which are not effective drugs compared to generic equivalents.
Yeah.
We should demand that stop. It's unnecessary. It does not add to our health care, but it adds a lot of money coming out of the system.
And anybody knows that's where a lot of the cost is. It's prescription drugs.
Absolutely. As a percentage, it's not huge, but when you look at the growth rate, it is huge, double digits and accelerating. And it's not because of new breakthrough drugs. It's because of price increases on existing drugs. And it's because Medicare, the largest purchaser of prescription drugs in the world, is forbidden by Congress to negotiate the price they pay. That's what we should be talking about. We should be beating on the doors of our congressmen, senators, and demanding that they address this. The real bottom line here, unfortunately, is we have a corrupt political system where 1,500 lobbyists from the pharmaceutical industry have a complete lock on Congress. That's the problem.
I know you're thinking this, so I wanted to ask John this. Will going to town halls, calling and emailing your congressman actually help?
We should go to town halls. We should send emails. We should write. We should call. We should demand that they take action in this area. And I think in many cases people don't bother because they have learned, they've been trained, in effect, to recognize that it doesn't matter. The pharmaceutical industry spends $200 to $300 million per year, and it goes into the pockets of congressmen. The number one priority of our congressmen is to get reelected, not to make our drugs affordable. So we should be outraged, and we should really make our voices heard. I'm trying to do my small part through the book, Heath Attitudes, in which I go into a lot of detail about the cost of our healthcare in America and how it could be improved. We can do it if we put our mind to it.
John promised to stay in touch with us to give us more perspective as things play out in Washington. Keep it right here on indieJourno.com.